Traveling in the U.S. has become an increasingly high-risk activity, as the country continues to record high daily death tallies, and public health experts warn that Thanksgiving will be a superspreader event. If you're planning to travel this week, it's prudent to avoid areas of the country that present the highest risk. Consider, also, how individual states are managing the crisis. Some states have dismissed pleas from countless public health experts, who say widespread face mask wearing is the most effective way for Americans to curb the spread of the coronavirus. A study published in early September from the University of Washington found that governors' partisanship was the key determining factor. The most important predictor is whether a state is led by a Republican governor, wrote the researchers. These states were much slower to adopt mandates, if they did so at all. More than 2 months after that report was published, the most recalcitrant Republican governors have yet to shift their policies. Here's a state-by-state rundown of the riskiest states to visit as we head into Thanksgiving, along with an overview of current COVID-19 protocols. Risk factors: new statewide mask mandate 203.6 new daily cases per 100,000 people. 14.8% of COVID tests are positive last week. North Dakota Governor Doug Burgum, a Republican, finally announced a month-long statewide mask mandate. Masks must be worn in indoor businesses and public spaces and outside in public spaces when social distancing is impossible. Burgum's critics say the governor has waited too long to address the crisis. Yesterday, Burgum said that he reversed his opposition to a statewide mask policy in response to the state's hospital capacity and staffing crisis. The Federal Emergency Management Agency FEMA is sending 60 Air Force nurses to North Dakota hospitals to assist with the COVID-19 response next week. North Dakota is racking up an average of 203.6 new daily COVID-19 cases per 100,000 people, on a rolling weekly average, according to the Harvard Brown Risk Assessment Tool. That's up 44% since last week. Any state with over 25 new daily cases per 100,000 people is colored red on the map, which means it is considered at a tipping point. North Dakota's risk level is more than 700% above that threshold. North Dakota's percent positive rate is 14.8%, according to data from Johns Hopkins University. The percent positive should ideally be under 5%, according to the World Health Organization. Positivity has been rising for the past 2 consecutive weeks. Risk factors: no statewide mask mandate 145.8 new daily cases per 100,000 people. 48.2% of COVID tests are positive. South Dakota Governor Kristi Noem, a Republican, has been so defiantly anti-mask that she's earned the unfortunate nickname of COVID Kristi. Her state was the epicenter of COVID-19 spread for several weeks until it was recently surpassed by North Dakota.